Hello, my name is Autumn Bruer. I am a developmental therapist for hearing, or a DTH. I work for the Illinois School for the Deaf's Klein House Birth to 3 program and through Illinois' early intervention system. Today I will be giving you information about the who, what, where, when, why, and how of the DTH. So, what is a DTH? A DTH is a service provider through the early intervention system that works with infants, toddlers, and their families. The child has to be between the ages of birth to 3 years and have a diagnosed hearing loss. The early intervention system is a federal program that is run by the state that provides services and supports to infants, toddlers, and their families. To qualify for this program, children must show a developmental delay in one or more areas or have a specific medical diagnosis, such as hearing loss. A DTH will work with the child with a hearing loss and their families to ensure the developmental milestones in all areas are met. A DTH has special education and training to understand the unique and complex needs of children with hearing loss and how hearing loss impacts child development. Specific areas of knowledge include how the listening systems work in infants and toddlers, tests audiologists perform to determine and monitor hearing loss, types, causes, and degrees of hearing loss, amplification options and how they work, typical language development for children with hearing loss, language options for children with hearing loss, and cultural concerns related to having hearing loss. What services does a DTH provide? A DTH will work with a child with hearing loss and their families to provide support and services related to hearing loss and how it may impact child development. A DTH will meet with the child and their family either weekly, 2 times a month, or monthly. The role of the DTH is as a coach or a guide to provide the family with strategies to maximize development. They use observation, coaching, and modeling to share knowledge and strategies. Services might include going to audiology visits, discussing audiological information, providing simulated hearing loss experiences, discussing amplification options, providing tips on how to maximize amplification usage, sharing language modes and options for children with hearing loss and their families, modeling language acquisition activities, sharing resources, co-treating with other providers such as occupational therapists, physical therapists, speech therapists, and the like, and connecting families with other supports. Who can benefit from DTH services? Any child with a hearing loss and their family can benefit from DTH services. In Illinois, hearing loss is an automatic qualifying diagnosis to receive early intervention services. Any degree or type of hearing loss qualifies. The technical qualification is 35 dB loss in one frequency or 30 decibels loss in 2 frequencies. You can ask your audiologist if your child meets this qualification. Where does a DTH work? A DTH will work in the child's natural environment. A natural environment is where a child spends most of their day with the people that know them the best. This may be at home, in a daycare setting, at the park, a place of worship, or even in a restaurant. Anywhere that the child feels comfortable and is able to communicate with their family, caregivers, and peers. What is not considered a natural environment is a clinical setting. A clinical setting may be used as a last resort if other natural environments are not available. A DTH may be an expert in child development for children with hearing loss, but the families and caregivers are the expert on their child's development. It is vital for the parents, family members, caregivers, and peers to be available in the natural environment during service delivery. Parents and caregivers are their child's first and best teachers. When should you start receiving DTH services? As soon as the child has a diagnosed hearing loss. Most infants born in a hospital will receive a newborn hearing screening. This screening will result in a pass or refer for further testing result. Newborn hearing screenings are not a diagnostic test. They just suggest the possibility of a hearing loss. It is important to follow up with diagnostic testing with an audiologist if further testing is suggested. Follow-up testing may be an OAE test or an ABR test. The ABR will test your child's brain response to sound. Results from an ABR will indicate if your child has a hearing loss and what type and degree of loss your child has. Once the diagnosis is made, it is time for intervention. How can you start receiving services from a DTH? Once a child has a diagnosed hearing loss, early intervention services are automatically available for that child, but a referral process is required. Anyone, a parent, grandparent, family member, or even a doctor, can refer a child to early intervention. After the referral is made, a service coordinator will reach out to the family and providers to set up evaluations, meeting, and an IFSP to get services started. Why should you use a DTH? To give your child the best chance to maximize their potential. Research shows that children with hearing loss that receive early intervention have a better chance to be ready for kindergarten.